All right, we have very few manual orthopedic tests that are both reliable and valid, and that is also true for the cervical spine, like other parts of the body. So we're just going to discuss two simple tests you can do for the cervical spine that have been shown to be valid and reliable, that you could then perform your treatment off of that. So the first one is just going to be, it was by Fernandez de las Peñas in 2007. He found that doing side glides to the cervical spine was as good as radiologic assessment in determining hypomobility of C3 through C7. So all you're going to do is your basic side glides, coming in, assessing each segment for movement, hypomobility or hypermobility or normal. So you just work up and down. And Joel found in some of her studies that there is excellent inter-rater reliability on determining hypomobile segments. So from there, when you determine a hypomobile segment, you could do your manual therapy, whether it's manipulation, mobilization, snags, anything like that. So that's the first one that would usually just be for normal hypomobility, neck pain, anything like that, that is a valid and good test. The second is for cervicogenic headache, which according to Nielsen in 95 is about 10 to 15% of headaches, but that is probably the best headache that we were able to treat out of the multiple types of headaches. So with that one, in order to determine if they have a cervicogenic headache, about a 90% sensitivity and specificity, you will fully flex the head, bring it up all the way, and then rotate to each side, assessing range of motion to each position. And then return back down. So the idea is there, if the total amount of cervical rotation in the spine is 90 degrees, roughly 45 degrees of that will come from C1-2. So ideally, when you flex totally, you're locking all the other segments besides C1, C2. So whenever you do your rotation, you should get 39 to about 45 degrees. Those are the normative values. So if you assess one side and you get 45, the other side is 20, 25 degrees is what they found to be pathological, then that side you could direct your manual treatment towards, again, mobilization, manipulation, snags, anything like that. So those are just two that have been shown to be pretty good for the cervical spine.